One of the reasons runners have lower leg injuries as well as back injuries is because their hip muscles are weak. So a simple way to test this on yourself is just to do a quarter leg squat with each leg and compare and contrast to see which one feels stronger and which one feels weaker. So I have our clients, all they do is just they have hands on their hip and they're going to do a quarter squat. Watch what my knee does. And they're going to go down about a quarter here, and you can see my leg wobbling just a little bit. My knee might be dropping in a little bit. That's indicative of some gluteus medius weakness. So I have them do about 4 to 5 on each side, and then I compare and contrast. Typically you'll find that runners are weak in the glutes and the gluteus medius. And I go to the other side. Again, you can see some wobbliness there. That's hip musculature not working, and you can tell if you're going to run and your leg's doing that, you're going to get some injuries down in the knee or even the foot or the hip. So we compare and contrast, and then we have all of our runners do 2 simple exercises. We have to do this every day. It's going to be a glute bridge and then a side hip abduction. So we'll start with side hip abduction, coming up here, hands right underneath the shoulders, hips are high, and I'm just going to go into a lateral hip raise. I'm working gluteus medius, obliques, working the shoulder, working up here gluteus medius, and you can repeat that on both sides. And then we go also have them do single leg bridge to work the glute muscles. Place their ankle on their knee, pull their abs in, and they're going to toes are up, and they're going to come up into a bridge to activate that glute muscle. Up and down. You want to feel it in the glute and not the hamstring. So these 2 simple exercises will help runners alleviate any symptoms that they have or any injuries that they have in the hip, knees, or feet.